In this video, we're going to be talking about universal precautions, which have basically these three tenets. Hygiene is about your personal hygiene. It involves hand washing and making sure that your hands don't have any cracks that pathogens are going to be able to enter through. It also involves the hygiene of the area that you're working in to make sure that there's not anything that you can trip over, not anything that's hazardous, stuff like that in the area. PPE is personal protective equipment that can include lab coats, safety glasses, and very importantly, gloves. You're definitely going to need gloves as you go through this semester. Sharps. You're going to use sharps while you're dissecting specimens and during your blood typing week, and you need to know how to properly dispose of sharps and then how to use those sharps. So let's talk about some of these things in a little bit more detail. I'm going to assume that we all know how to wash hands. We've all been through COVID, so we've all heard the happy birthday song and all of that sort of jazz. After you've washed your hands, for various labs, you guys are going to need to be able to don gloves. Gloves need to fit appropriately for you. If they're too snug, they're very likely to tear or split. If they're too loose, it makes it very hard for you to grip things. And so personally, I'm a size medium, but you need to make sure you're able to get into the gloves that fit you. There's different kinds of gloves. If you have a latex allergy, get vinyl or nitrile, whatever, again, works for you. Putting them on, not a big deal unless they're sterile gloves, then there's a specific technique for putting on sterile gloves. As you do your dissection, you should definitely be wearing gloves and safety glasses. Protecting your clothes is something that might be a worthwhile cause as well. For your blood typing lab, if somebody is going to be poking you because you are not comfortable doing that for yourself, they should be wearing gloves. If you're poking you don't need to be wearing gloves because you should not be poking through the gloves. The lancet that you use to poke with is a sharp. So let's talk about sharps for just a moment. Sharps, they usually come with a cap to protect the sharp thing inside of them. One of the first things you're taught is that you should never recap a sharp, and yet that's one of the first things that go out the window when you're actually out working in the field. But recapping a sharp, it's one of the first ways you're going to stab yourself with a used sharp. So don't recap a sharp. Sharps have to be disposed of in a sharps container. Those are usually not something people are going to have at home. So most municipalities are okay with you disposing of them in a hard plastic container like a used milk jug, orange juice container, or something along those lines. So once you've used the sharp, it should go in here. Biohazards are any bodily fluids that might contain potential pathogens. If it's not a sharp biohazard, it's supposed to go into a biohazard bag so it can be properly disposed of. Again, you don't have access to that usually at home. So while you're doing your blood typing lab, anything that touches the blood, including the sharp, it's going to go into the same container. So the toothpick that you use to stir your blood, the blood typing card, anything that gets used during that lab, put it into that same used container and then pour some bleach into it. Once you're done, cap it, and then you can dispose of it in your regular trash. That's how you're going to get rid of your sharps and your biohazard during your blood typing week. Now, let's talk about the gloves. The easiest way to sort of think about doffing your gloves, which is the fancy way of saying taking your gloves off, is to think dirty can touch dirty, clean can touch clean, and never let them go in opposite directions. So as you take your gloves off, you can take the dirty outside of one glove, pinch the outside of another glove, and then pull it off. And you should not hear any snapping or anything as you pull the glove off, because if the glove's elasticity flings material like droplets, you're flinging pathogens around the room. So don't do that. Take that glove and ball it up into the other hand. Now you have a clean hand. Clean hand is not going to touch the dirty outside of this glove. You're going to slide it under and then pull gently this glove off. Again, no snapping sounds. Now you have a nice little used container of glove that for the blood typing lab can go into your sharps container. For any other lab, you can just dispose of it in the regular trash. I hope that helps you stay safe during your lab, and now you understand universal precautions a little bit better.